You know, there are about 4,800 new cases of breast cancer diagnosed among women each year just in Minnesota. And that is why mammograms and catching some of those subtle changes early, all of that can be so important.
So important. So here to have a conversation with us about this is Kathy Johnson. She is a breast health clinician from HealthPartners and the Park Nicolette Jane Bratton Breast Center. So welcome to the show, Kathy.
Thank you for having me.
Yeah, it's good to see you.
Absolutely.
So like with a lot of cancers, I think we all understand that you're going to have the highest percentage of curing it if you catch it early, right?
Absolutely.
The earliest possible,
Absolutely.
right? So and mammograms are a great way to do that.
They are. You know, the average woman who finds a lump, it's between a peanut and a walnut. And mammograms can find a cancer when it's a half a pea.
Wow.
Half a pea.
Have they gotten better over time, too? Have you seen the technology change? Because you've been working with patients for a long time.
I have. I've been at the Jane Bratton Breast Center for 12 and a half years that I've dedicated my practice to specialized breast care.
So are you seeing more like, I mean, because I know there was always concerns about like some people have dense breast tissue, some people, you know, can you find them better as the technology improves?
Absolutely. You know, we have 2D mammography and 3D mammography. And I can tell you in the 12 and a half years I've been there, that was a new advent.
Oh, wow.
Yeah, and 2D mammography, I think of like if you have a loaf of bread and you are looking through the loaf of bread and 3D mammography is like I'm taking slices of the bread.
Okay.
So the technology has changed and it assists us in picking up smaller cancers.
Interesting.
Okay. So when you've been in this thing for 12 years, and I'm sure obviously you've had them yourself, and you know a lot of people, why do I feel like there's a lot of myths still behind it? Because it is safe and it is painless, correct? Like, what are some of the biggest myths you want to bust about mammograms?
Yeah, you know, mammograms do get a bad name because about 10% of women who have a mammogram get called back. And they get called back because we want to look at another area more closely. And of those callbacks, most people do not have cancer. And the callback is difficult because people get their heightened awareness and it really is worrisome.
Yeah.
And if we can just take it a step at a time and know that when we take additional views, sometimes we do what's called a magnification view. We put a smaller panel on. We can look at the area we weren't sure about. Sometimes we take it from a different angle, the breast. So, you know, I think that's where callbacks are one of our big obstacles.
Yeah, because people are afraid to know. If you do feel something or notice something, you can get in pretty quickly. I mean, I'm seeing here same day and walk-in appointments are available. I didn't realize that.
Yeah, so Park Nicolette HealthPartners, we have 35 sites that do breast care, and that's a lot. That's in the Twin Cities Metro and actually, what is that, Western Wisconsin.
But you know, when you see the numbers that 1 in 8 chance of developing breast cancer, I mean, I think that also contributes to being so nervous about the callbacks. And the reality is, I mean, if you are a human being in this country, you know someone who has had breast cancer. That's it.
Absolutely. Absolutely. Our biggest risk for getting breast cancer, though, is being a woman and being an aging woman. We do see breast cancer in men, but one breast cancer in a man to about 100 in a woman.
Wow.
Oh my gosh. So how do we know anything about causation? Do we know, is it lifestyle? Is it nutrition?
Family
is
history?
It family history? Like, what do we need to know about that?
Yeah, so our biggest risk factor is being a woman. Well, I don't know if I can qualify them in order, but definitely family history plays a role, as you mentioned. The breast density that you brought up, that plays a role as well. We know the more dense a woman's breast is, she's a little more likely to get breast cancer.
Okay.
We know that obese women get more breast cancer. And that's such a difficult topic on so many health issues.
For sure.
For sure. And we know fit women get less breast cancer.
Yeah.
We know women that have a baby before they're 30 get less breast cancer. We know that breastfeeding helps decrease breast cancer risk.
I'm like listing, I'm going up, I'm going up, down,
Yeah,
okay,
yeah.
nope, nope, all right, I'm about even.
Yeah.
Exactly. The one that I think most women don't realize is that there is a direct correlation between alcohol consumption and breast cancer development.
Oh, wow.
The more a woman drinks alcohol, the more likely she is to get breast cancer.
Tricky stuff. Okay, so
okay.
at what age do you start getting mammograms? How often do we need to get them? What are the current recommendations?
The American College of Radiology recommends yearly starting at 40. That is the standard of care. There has been over the years different medical organizations having different times to get started that I think has been confusing for women. This last year we were really excited that the United States Preventative Task Force said yes at 40. That's a conversation to have now. They used to say 50. So, 40 is a very good time to be talking to your doctor or your healthcare provider, your PA, your nurse practitioner, your healthcare provider.
Yeah. So one of the scary things that you're trying to bust for us today is that, like, some people are apprehensive because they just don't want to get the call back. They just don't want to know, right? The other one might be cost. What would be the cost of something like this? Insurance covers it, I'm assuming?
So in 1988, actually in Minnesota, we had a law that said insurances must cover screening mammograms. Okay, so screening for most insurances is 100% covered. Now we talked about that 2D, 3D.
Yeah.
Some insurances will only cover the 2D. The 3D is a different charge because there are more pictures to evaluate. But Medicare, a few years back, started covering 3D, and most insurance companies start to follow Medicare. But it's always something to check with your insurance carrier.
And if you are diagnosed, I would assume that then it's like we spring into action with the care right away.
Yeah, I think we have a really unique setting because we have myself and my colleague, another nurse practitioner, Katie Hauslog. We see actually people who might call up and say, I need a mammogram because I have a lump. But a screening mammogram is inappropriate for someone with a symptom. And so they need to have what we call the diagnostic films.
Yeah.
And so we offer appointments to see them and not just a facility that does x-rays.
Okay.
And then if by chance we have this lump and we see it and it's suspicious, we have either ultrasound guided biopsies or stereotactic, which is a mammogram guided biopsy. And let's say that unfortunately came back as a cancer. We have 4 breast cancer nurse navigators that are integral to our program. So when someone gets diagnosed, they're going to get called within 24 hours of that result coming back. They're going to be set up with either a surgeon, an oncologist, maybe a genetic counselor. So we have a team that's ready to roll.
That's so great.
A club you don't
Kathy?
want to be part of, but the support is there.
Yeah,
Thanks,
such vital
Kathy.
information. Thanks so much.
Absolutely.
All right, to schedule a mammogram with Health Partners, we're going to post a link on TwinCitiesLive.com.